We say that whilst the eyes might be the window to the soul, the mouth is the doorway to disease. So what does that mean? Well, in essence, what I'm saying is if your mouth is unhealthy, if it's got untreated disease or inflammation or infection, then that's increasing your risk for ill health, and it's actually already making you sick. So gum disease, and that's characterised by red, bleeding and swollen gums. Did you know that really allows harmful bacteria to spread from your mouth round to the rest of your body? Gum disease means that your gums are actually inflamed and infected by bacteria, and the blood that's flowing through those infected gums is flowing through the rest of your body. And that means if you've got inflammation in your mouth, you've actually got it spreading everywhere. Now, inflammation is the trigger to many of our chronic and life-threatening health conditions. And inflammation is now being linked to things like heart disease, high blood pressure, dementia, and even types of cancers. Hey Luke, good to see you. Thanks for joining us. If you have any questions, then please pop them in the chat, and I'll get round to answering those, or maybe doing a whole video on them for you. So as a dentist, I get the unique opportunity of actually looking inside your mouth and being able to see the condition of the inside of your body. I also get to look for and spot the warning signs of inflammation and disease that are contributing to or setting you up for these chronic health issues that we've mentioned. I can also look at your mouth and know if you're unhealthy or have a systemic disease, because what's going on in your mouth shows me that things aren't right. So that mouth is the window to the health of your body. It can show me signs of nutritional deficiencies and general infections. Oftentimes with systemic diseases, those that affect the entire body, like diabetes, blood cancers and more, they can be picked up or first detected by looking in the mouth, because there can be the presence of mouth lesions or other problems like bleeding and swollen gums that give indications that something's not quite right. And look, over the years, this is my 25th year in practice now, I've lost count of the number of patients that I've seen where what I've seen in their mouth has really triggered alarm bells for me, and I've gone, hang on, something's not right here. And so because their gums aren't responding well to the dental treatment that we're doing, we're concerned about that. So we'll send people for blood tests and get them to have medical care. And we've helped people diagnose their diabetes as being pre-diabetic, being anemic or low in vitamins and trace minerals, having hormonal imbalances, and sadly in a few cases we've even detected leukemia. But the good news is that because we're able to spot these things and we're looking out for these abnormalities and unusual patterns, we can tell a lot about your health, and we can be one of the first in your practitioner healthcare providers to actually say, hang on, something's not right here, we need to look into this. So your mouth is filled with countless of bacteria, about 6 billion I think the last time they did a count. Some of those bacteria are linked to causing tooth decay, and other groups are causing gum disease. But the majority are actually responsible for keeping your mouth healthy. But if you get the wrong type of bacteria, you will get increase in tooth decay. You'll be more prone to gum disease, and you'll even be prone to bad breath. Now, researchers have shown recently that gum disease and advanced forms of it are definitely linked to other health problems. Cardiovascular disease, stroke, bacterial pneumonias, blood pressure problems, rheumatoid arthritis, even dementia and Alzheimer's, and types of cancers, particularly in recent studies, pancreatic and esophageal cancers. There's studies showing that pregnant women with gum disease are at increased risk of delivering preterm and low-weight babies. So you can see that if you've got problems in your mouth, if you've got unhealthy gums, that's going to be having a big impact on your overall well-being. So the bacteria and inflammation linked to gum disease spread via the bloodstream, travel around the body, creating systemic inflammation, and that plays a role in those systemic health conditions. Then diseases that you may have, or health conditions like diabetes, blood cell disorders, HIV/AIDS, that lower the body's resistance to infection, make gum disease more severe, harder to treat and harder to control. And we see acceleration in gum disease very quickly, or we see gum disease that we can't resolve and help heal and keep stable. So there's been several studies that link chronic inflammation from gum disease with the development of cardiovascular problems. Mouth bacteria linked to heart disease, blocked arteries and strokes. People with diabetes have gum disease, and it makes it more difficult for them to control their blood sugar levels. And that in turn worsens and accelerates the gum disease, so it becomes a vicious cycle where it becomes very, very hard to control that diabetes. And particularly, with someone who's older and their nutrition is poor, then we see more problems. So it's a bit of a chicken and egg scenario, and we're not sure exactly which comes first. Is it the gum disease or the health condition? But we do definitely know that they're linked, and they're being caused or worsened by inflammation. So gum disease is an inflammatory process, and our job as dentists and hygienists is not to clean your teeth. Yes, that's part of what we do as the treatment, but the treatment is actually based on halting and reducing inflammation so that you don't get damage to the gums and you're not getting bacteria spreading around your body. So if we can control inflammation in your mouth, we can help reduce it in the whole body, and that's a fact that's been known in medicine for over 200 years. So what can you do? What part can you play in having a healthy mouth and healthy body? Well, prevention and proper treatment of gum disease is very important to stop mouth bacteria from entering the bloodstream and travelling to other parts of the body, causing more inflammation. So the basic and universal advice, which I'm sure you all know, is to brush your teeth thoroughly for 2 minutes every day. On average, people spend about 20 seconds and only do this bit at the front. Now, 20 seconds is not long enough to remove the build-up of bacteria that we call plaque on your teeth. The longer that plaque has been there, it starts to calcify from minerals within your saliva, and it becomes hardened and is called tartar. And that then gets covered in more bacteria, and it thickens up and it irritates and annoys the gums, creating inflammation. So you imagine having a dirty splinter stuck under your skin for a period of time and it gets infected. It's going to be red and swollen and uncomfortable. It's no different with the gums. Hey Sharon, nice of you to join. If you're getting value from this, then please give us a heart or leave us a comment. Please feel free to share the video. Same if you're watching on the replay. So you need to give your teeth a proper clean. It should take at least 2 to 3 minutes. If you're not sure how long that should be, then just please set a timer on your watch or your smartphone, or get a decent power brush with an inbuilt program so you know you're cleaning them for long enough. You also need to clean in between your teeth because your toothbrush doesn't reach everywhere, and by not cleaning in between your teeth, you're leaving between 40 and 60% of the tooth surfaces unclean, and you're leaving plaque and bacteria there that are going to damage your gums. If you're finding floss very difficult to manage, there are lots of products on the market like interdental cleaners, which are like little brushes that go between your teeth, and we need you to do that at least once a day, preferably after your last meal so you can clean out any food and deposits. I'd also recommend using an antimicrobial mouth rinse, and that's designed to reduce harmful bacteria, and you use that at least once a day. Other things that are going to help with your gum health and prevent gum disease are eating a balanced diet, having a diet of real food, which is low in processed food, reduce your sugar intake, don't smoke. Smoking is one of the worst things you can do for your overall health and your gum health, and you should schedule regular dental checkups and hygiene appointments. Those professional hygiene appointments, they're designed to remove the buildup of plaque, bacteria and tartar from around your teeth and under your gums. They're going to reduce inflammation, and the outcome is that we can halt the progress of gum disease. It's then for you to play your role at home by taking care of your mouth and gums and your overall health and your well-being and doing what's needed. It's a little bit like when you go to the gym or you have a personal trainer. What you do in that session accounts for about 20% of your fitness. The other 80% is how you're looking after your body, what you're eating, how you're taking care of yourself, are you sleeping well, are you hydrated? So I want you to just be aware of what the signs and symptoms of gum disease are, because these aren't just telling you your gums are unhealthy, but they can be a sign of poor overall health, not just in your mouth, but in your whole body. And I don't want you to ignore these symptoms or signals. This is your mouth talking to you and letting you know what's going on. And I also don't want you to think that it's normal. People think that because something happens a lot, it's normal. It's not. It's actually a sign of a problem. So if you have gums that bleed when you're brushing or flossing, that's not a good sign. Are your gums red, swollen or tender? If you have gums that are pulling away from your teeth or receding, if you've got persistent bad breath, if you've got discharge or pus coming out from your gums and teeth, if your teeth are starting to get loose or spread or move, if there are changes in the way your bite or your teeth fit together, have you noticed teeth that are drifting or moved, and do you have a bad taste in your mouth? All these things are signs of poor gum health, and they can also be signs of systemic health conditions. So if you have these or you've noticed any changes, then it's time to seek dental advice and treatment before it's too late. Gum disease left untreated will eat away at the support bone in your jaw that holds your teeth in place, and eventually your teeth will start to get loose, they'll become infected and abscessed, and unfortunately the end result is that you have to have those teeth taken out. And that's a real shame, because it's something that could have been prevented, and it's something that could have been halted and held stabilised had treatment been done. So gum disease is actually multifactorial. It's not just caused by poor brushing and lack of flossing. So it's actually caused by many things, and it's influenced incredibly by your diet and your lifestyle. So any changes in your health, your medication, your sleep, your hormone levels, particularly for women who are around menopause, any changes in your nutrition and your stress levels, this all plays a really, really major part in how healthy your gums are. So when we're assessing your gum health, we also want to know what's going on with you from a health and lifestyle perspective. So it's important that you let your dentist or your dental hygienist know about those changes in your overall health, any recent illnesses or chronic conditions. We'd also like to know what medications you're on, both prescription or anything you're buying over the counter, any herbs or supplements or natural products that you're taking. We're also interested to know about any alterations in your life or your work circumstances that could be impacting on your dental health. This way we can piece together what's going on, so we can piece together what we're seeing and what your mouth's showing us and what you're telling us. That way we can prescribe the best treatment for your dental health and for you, because we're not leaving parts of the puzzle to one side. So I often see patients who ask me, why is it that my gums still bleed? I'm brushing twice a day, I'm flossing, I'm doing what the dentist and the hygienist have told me, but nothing's getting better. Once we start delving into their lifestyle, their dietary habits, and things that are going on with them, we actually start to see that there's more to their condition than meets the eye. So someone who's not sleeping well will be more inflamed and their gums bleed more easily. Same as if you're stressed, you produce a hormone called cortisol, and that cortisol is pro-inflammatory, which means it creates inflammation, and therefore your gums are going to show signs of that by bleeding more easily and more readily. So you can see how these pieces come together and help us, particularly as a holistic practice, understand what's going on so that we can prescribe the right treatment. Great to have so many of you listening and joining in live. Please give us some love. Do share the video. Please post any comments in the chat and ask questions. I'd really like to do a whole series of videos for you. So if there's anything that we can share information about, that would be really fantastic. So as far as I'm concerned, a healthy body starts with a healthy mouth. Your gums should not bleed. They should not be swollen or red. Those are signs of bacterial infection and inflammation that are going to be damaging your gums and your body health. So what can you do that's going to support your gum health and prevent gum disease or put a halt to the process? And how can we do that as naturally as possible? So really the number one thing is to have a regular dental check, attend to any dental hygiene issues that you have, so that the buildup of harmful plaque bacteria and damaging tartar can be removed from around the teeth and under the gum lines. By doing this, we can quickly help reduce inflammation and switch off the active disease. But depending on the severity of your gum disease that you present with, this could mean simply 1 or 2 visits with the hygienist, or more prolonged and intensive course of gum therapy over several visits to thoroughly remove all the buildup, treat the infection in your gums, and leave a nice, clean, healthy surface for your gums to heal around. Points number 2 and 3 are really down to you. That's to address any diet and lifestyle factors. So things like poor nutrition, poor oral care, stress, smoking, alcohol consumptions, toxins that are in your body, and lack of sleep are going to lead to or accelerate any gum disease. And it's important that this needs to be addressed. So I can see a question there, so I'm just going to have a quick look. I've just got to move my screen. So mouth ulcers, that's a really good question. Mouth ulcers are often a sign of stress and strain on the body, of being run down, and also being low in B vitamins. So it's important to address those stresses, look at the nutrition, get more sleep, and then when you do have an ulcer, it can be the healing can be speeded up by just rinsing around with a simple warm salt solution or using a good antibacterial mouthwash. But really those ulcers, if they're happening regularly, that's showing you that the body is fatigued and stressed and is crying out for a bit of support. Other reasons that people get ulcers is that they can traumatise their mouth. You know, if you knock it while you're eating, or you brush it too hard, or you slip with your toothbrush, that can give you an ulcer. But the common reason for recurring ones is usually a nutritional problem or fatigue and stress. So I'm going to recap on gum disease and how that relates to your health, and also just take it a little bit further. So gum disease is one of the most common infectious diseases known in the world. Yes, it's infectious. So if you're kissing somebody else and they've got gum disease, they are going to inoculate you with their gum disease bacteria. I know that sounds horrible, but it is the truth. So with babies, where we blow on their food, or we might give it a little taste to check that it's not too hot, and then we feed it to baby, we are giving them our mouth bacteria. Now, if our mouth bacteria is good and healthy, then that's a good thing to pass on. It gives them then bacteria that are going to help fight the harmful, nasty bacteria. But if you've got gum disease and it's untreated, you are sharing that with other people. So we could be treating a husband and wife, and one of them's got a really healthy mouth and the other one hasn't. The one who hasn't got the problems is likely to develop them because they're getting inoculated. So thank you for asking your questions and being here tonight. It's really wonderful. So as I said, gum disease is the most common infectious disease. It affects about 4 billion people worldwide. When it's advanced, it's called periodontal disease. And it's an often ignored health problem because people don't pay attention to what's going on in the mouth. They're a bit unaware. They don't really understand. And gum disease, a little bit like heart disease, doesn't cause pain. You don't know when you've got heart disease that your arteries are thickening up and you're about to have a heart attack at some point. It's a little bit like that with chronic gum disease, is you don't realise you've got a problem because it's not painful. And we think as human beings, no pain means everything is all right. But your mouth's already been telling you that something's wrong because every time you brush and floss, it's bleeding. Now, if you washed your hands and they bled every time, you'd want to know how to make that stop. So why don't we make that correlation with our gums? It's really bizarre that we can ignore bleeding, or we think, oh, well, I won't brush my gums then because they bleed, and that's the answer to the problem. So it's an ignored health condition. It's linked to increased risk factors of cardiovascular disease, arthritis, diabetes, dementia, and even types of cancers. By changing your lifestyle habits and your diet, you're going to hold the key to reversing this major threat to your health. Now, one of the problems is our modern day diet. In fact, it's probably one of the major reasons why we've seen such an increase in gum disease, which I'm seeing in younger patients. And recently I've seen so many patients in their 20s with advanced gum disease. They've got bone damage around their teeth, inflamed gums and infection. And look, really what I put that down to is the poor diet that they're on. Too much processed food, too much sugar, not enough real food, and not enough nutrients in their diet. So in our ancestors, tooth decay was nowhere near as prevalent as it is today. It's believed that because we adopted a carbohydrate-rich diet, that we started to change the bacteria in our mouth to ones that were more damaging and harmful to our teeth and gums. And so we now have industrially processed flours and sugar, and that's causing and is still responsible for an explosion in the incidence of tooth decay and gum disease. Hi Cheryl, hi Kate, thanks for joining. So the increased consumption of grains and cereals has had a marked increase, and it sees a big build-up in dental tartar called calculus and the plaque bacteria. And then those sugars that we're getting in syrups and juices, soft drink and concentrates, and just added into our diet, the increase in eating lollies and biscuits and chocolates and sweet snacks, cakes, etc. Those sugars produce the acids that cause tooth decay. So we're getting this double whammy of food destroying, of food that is destroying our teeth. And that food is also making us nutritionally deficient and impairing our ability to defend ourselves against the bacteria. So we get this cyclical thing going on. So then the gum disease creates infection and so on and so forth. So because so many people are unaware of the consequences and they remained uninformed about the best ways to care for their mouths, they're increasing their risk for disease. And the bottom line is poor nutrition, toxicity and chronic inflammation triggered by poor oral health is putting our lives at risk, and so much of this is avoidable. So what are my recommendations? What advice can I give you that you can take home from this to support yourself that's not just brush and floss more? Because any dentist can tell you that, and I think you all know that, you're intelligent people. So I'm going to recommend that you eat real food, and that's to eat food that's unrefined, unprocessed, so whole and natural foods. And these foods by their very nature are nutrient dense and they're anti-inflammatory, and that's two really important factors when it comes to maintaining your dental health and your body health. So I'm also going to share that not all bacteria in your mouth are bad. Not all of them are going to be attacking your teeth and gums. Out of those 6 million bacteria that are in your mouth, the majority are actually healthy or good bacteria. And these healthy good bacteria support you to have a healthy mouth environment. They actually suppress the build-up of the bad bacteria. It stops them from overgrowing and causing that harm that leads to inflammation and disease. But if you don't feed those good bacteria the right things, those bad bacteria will and do take over. The other thing that I'd like to just touch on is that using harsh mouthwashes, the sort that explode in your mouth, we've seen those adverts, also damage the healthy bacteria. And this leaves an environment where there's nothing to defend and protect you. And the bad bacteria can actually grow unchecked because there aren't enough of these good bacteria left to keep them under control. So we need to look after those healthy dental plaque bacteria because they're fighting the disease-causing bacteria. They're actually helping to remineralise your teeth to prevent tooth decay, and they help stabilise acidity levels, and they need to be looked after and cared for properly. So it's important that we realise that there's a fine balance with what's going on in our mouth, and doing the wrong things to our mouth and our body are going to have consequences. So inflammation can really upset this delicate balance, as can poor food choices and poor oral hygiene habits. So I don't believe the bacteria in your mouth should be killed by using really aggressive mouthwashes. You can use mouthwashes that have natural oils and anti-inflammatory components, because that's going to be creating a healing aspect and leaving your good bacteria alone. So let's feed those good bacteria and encourage the growth of those beneficial microorganisms. And they actually produce a product called hydrogen peroxide, and that's a natural antibacterial that helps keep the nasty, harmful bacteria under control. So to decrease the growth of the harmful bacteria in the mouth and promote the growth of the beneficial ones, you can eat what are called prebiotic foods. So these prebiotics actually help support and nourish the good bacteria as well as you. So those are things like garlic, onions, avocado, apples. So yes, apples are good for your teeth, and also asparagus. And simply avoid processed, refined sugars, junk foods and soft drink. I often see so many people who are trying to get healthy and get fit and overcome health conditions and health problems, and they're wanting to take better care of themselves, yet they neglect one of the key elements. And that key element in having a healthy body is having a healthy mouth. So I get people come in, they're really fit, they're athletic, they eat organically, they eat clean, they're paleo, they're really into their health and well-being, yet their mouths are filthy. Their gums are really, really, really unhealthy, and that just goes against what they're trying to do. It's actually counterintuitive. It's stopping them making progress. So if you're enjoying this, please share it. If you're getting value, then please share it. Share it with your friends. I'd like more and more people to understand that their mouth health is really important. Please share some love, give us some hearts, leave me some comments and ask questions. So just because you're not in pain and your teeth don't hurt or your gums aren't sore doesn't mean everything's okay. Bleeding, red gums, swollen gums, bad breath, obvious build-up on your teeth, any sensitivity or changes in your bite, they're all signs that something is not right. So you can have gum disease and not even know it, just like you don't know you've got heart disease and your arteries are blocking up and you're about to have a heart attack. So please don't ignore those warning signs and avoid having dental checks, because they could potentially not only save your teeth but save your life, because we can pick up on health conditions by what we see in your mouth. So your mouth can be a source of inflammation and infection and toxicity to the rest of your body. It can be stressing your immune system and creating more inflammation and putting you at risk of serious life-threatening disease. And as a dentist, I see my role as being part of your healthcare team, helping you to have and keep a beautiful, healthy smile so that you can have a long and healthy, enjoyable life. So essentially, is it time for you to stop ignoring what's going on in your mouth and start listening to what your mouth is trying to tell you? Stop ignoring those warning signs that you have gum disease and inflammation. Make some simple changes to your diet and lifestyle, and have your gums professionally checked and treated, and this is going to go a long way to preventing and reducing your risk for serious illness and disease, and also allow you to keep your teeth for life. So I'd just like to wrap up by saying your mouth and your body are connected. If you've got a poorly, unhealthy, sick mouth, that's going to be adding to illness and disease in your body. So I'd like you to take some of these messages home, spend longer cleaning your teeth, get that floss out, floss in between your teeth, start eating well, looking after your sleep patterns, and make some simple adjustments in your diet and lifestyle. I can just see there's a couple of questions there, so I'm just going to move a few things just so I can see that. So someone's asking about a friend who whitened her teeth with peroxide and whether that's recommended. Look, as long as the concentration's not too high, maybe 3 to 5%, then that peroxide will reduce staining on your teeth and it will gradually whiten them. It will also kill off the harmful bacteria. You just have to be aware that using something like that too often in too high a concentration will cause damage. But we'll often recommend peroxide mouth rinses to patients to help expedite their gum disease, or we'll actually syringe peroxide around into the gum spaces after we've done a professional dental treatment to help kill off the nasty bacteria that have been dislodged. So as long as your friend Cheryl's not using something that's too strong, I'm not against that. So yeah, it's actually a beneficial thing to be doing. So thank you very much for joining me live. Thank you if you're watching the replay. I've really enjoyed sharing this information with you. And basically I'm going to call this first few videos that I'm doing the foundations of holistic health and holistic dentistry. And on my next video I'm going to be talking about heavy metals, and I don't mean the sort of rock band type music. I'm talking about heavy metals as in mercury, cadmium, arsenic and lead. And mercury has a special interest in dentistry because it's actually used in some of your dental fillings. So if you'd like to learn more about your dental health, about what's going on in your mouth, what chemicals are in there, what potential impacts that can have, then please join me for more Facebook Lives every week, and please put your questions in the comments box and we might do a whole video on those. So thank you very much. Please share this video. It's been fantastic, and I'll speak to you next time. Bye bye.